You're listening to Voces Feministas. Cindy is here, and this is Guille Quiroz. We have our guest here in the studio of KUNM, and I'm very happy that she is here. Kathryn Hall-Trujillo. She has a master's in public health, and I just asked her what a DDiv means, because it's part of her curriculum, and it's Doctor of Divinity. And gosh, you have a long trajectory on public health work, organizing and entrepreneuring for groups and institutions. So you have been addressing the racial and gender divide in women's access to healthcare. You have founded the Birthing Project USA, the Underground Railroad for New Life, and a global maternal and child health care organization, which has provided technical support and resources to maternal and child health stakeholders in 13 countries. So you focus a lot of international work within the Masters in Public Health. And you've been an independent scholar of the Cuba public health system. This serves on the medical advisory, you serve on the medical advisory board of Interreligious Foundation for Community Organizing. And if I just keep going on of everything that you've done, I think half of the show will go by, you know. So Kathryn, and you've also received an award from the University of California, UCLA, for your Public Health Lifetime Achievement Award. It's an Ashoka Global Social Entrepreneur Fellow and proud member of the Arkansas Hall of Fame. So first, you know, Kathryn, what brings you to New Mexico with all this traveling and well, this public health work that I bet that it hasn't been easy?
Oh, well, that's an easy question, and it kind of connects all those dots. I'm in New Mexico because 25 years ago, the country of Cuba gave the United States 500 medical school scholarships for young people in the United States to come to Cuba, get an absolutely free medical education, and to come back to the communities that made them want to be doctors in the first place. And I am a midwife, and we had a midwife clinic in California, but we didn't have any doctors. Because when you go to medical school in the United States, when you graduate, you usually owe so much money, you can't work at a nonprofit midwife's clinic. And I met a man on the way to Cuba from New Mexico that happened to be one of the two recruiters for New Mexico for this program, because you know New Mexico has the highest rate of brain drain for doctors in the country.
Yes.
And so as soon as New Mexico heard about this, they wanted to be in. So the two of us met actually on the way to Cuba. We fell in love. The next year we were married in Cuba, and I'm back in New Mexico, and I've been here now for 21 years.
Oh, wow. Wow. Well, what you're saying about the lack of doctors here in New Mexico, you're right. I don't have the exact statistics, but I personally have lived the lack of primary care here in New Mexico and the lack of certain specialties. Yeah. Especially surgeons, oncologists.
Yes.
Many other specialties. So what does that have to do? What happened 20 years ago of this free, scholarship at no cost? What does that have to do with today?
Well, the good news is, and because we were married, in the midst of all of this, we call the students who have and do attend the Cuba Latin American School of Medicine. We call them our babies.
Oh.
And I'm happy to tell you that we have 257 doctors on the ground now, and we're not ashamed of any of them. And 12 of them are actually here in New Mexico, doing everything from maternal and child health to rural health to, thank God, geriatric care. And since the program started, New Mexico was the first university to welcome those students into the residency program. So we two just started residency last week here. One is doing the second year, and we have one that will be starting in a few months. And so New Mexico is becoming a symbol of the collaboration between Cuba and the United States, because some of the things that they are doing in medicine are so important, and those of us that would benefit from that really want to see a relationship with Cuba where we can work together around the things that they are excelling in that we need, and sharing them the resources we have so that they could do more of what they do.
Sure. So you're saying that this program is still happening?
It's still happening. We're on our way to Cuba next Friday, because we have 5 more. This time is the 5 graduates are all women. We have 5 young women who are now doctors. And we're going to graduation.
So that sounds pretty active. So you mean that the UNM Academics of Medicine recognizes this work?
That's right. And it does make people trip over the words, because we just are the personality of the United States is we tend to not value people who come to the country from other countries and the gifts that they bring. And so there's kind of a stigma if you're a doctor from another country that comes to the U.S. for a lot of reasons, but one of them is that you don't speak English. And so the tables are turned. No matter what country you're coming from, if you're one of the 113 countries that's at the medical school in Cuba, which is the largest medical school in the world, by the way, the first thing you do is you have a year to learn to speak Spanish. So all of them speak Spanish. So our students that graduate, when they come back, they speak Spanish. And so New Mexico is a Spanish-speaking, I almost say country, but it feels like a country to me because it's so unique. But, one of the states where they're particularly open to doctors who have the same language and the same culture and are blending more of a universal style of medicine than the traditional style that you would learn if you didn't learn medicine outside. If you learned medicine outside of the United States.
Of the United States. So that means that these students that are going to Cuba, they come back.
They come back.
Yes.
They don't have a problem with the exams because they are bilingual in both English and Spanish. And there are people who wanted to be doctors because they knew there was a problem in their communities.
So, Kathryn, I think you've answered one of my questions. What can you say of the Cuban Public Health Service? Because many people feel it like a taboo. Is it true that the medical services in Cuba is at no cost to the people?
Yes, that is true. Number one, and I have a special role there in public health. We thought in the beginning that if we got 500 new doctors, for some reason that was going to change access to care in the U.S. And when I started running into the young doctors that had gone to medical school in Cuba, they were very disappointed because the system of care that the rest of the world practices, they were not allowed to practice it in the United States because, one, we don't have a free system, and two, the communities that they come from don't usually have a system for them to go back in and work. And so system was the magic word. And so what the Cubans did for us, because I'm a public health professor, is allowed me to teach a class at the National School of Public Health in Cuba to the policymakers in the United States
okay.
that are as frustrated as the students because we don't have that kind of a system. So I teach to policymakers, I teach to practitioners, doctors and nurses, anyone in the system. I teach to community midwives and doulas and to students in public health so that we could get an idea of what a public health system really looks like and what do we need to be concentrating on. So probably the most unique thing and the bottom line about the Cuban public health system is when you're born into your doctor's practice. Every neighborhood has a doctor who lives in a house in that neighborhood. And that doctor is responsible for you from the time before you're born, actually, until the time you die. That's your primary health care provider.
So that's one difference between the healthcare system over there and over here. So that means that the primary healthcare provider knows that there is a lot of commitment in their life to that neighborhood.
Yes, those are their neighbors. And because they live in the neighborhood, I will give you an example. I'm almost 80 years old. And I am so happy that one of the doctors here...
You don't look like it.
That's because I spent 2 weeks a month in Cuba. But one of the doctors here is actually, I think he's now a director for one of the Pueblo health centers, and he's doing a geriatric practice. So the very first appointment I had with him, I was at his house where he has an office, and I was knocking on the door, ringing the doorbell, because he wasn't there. And I called him to see what happened, and he answered the phone from my front porch. He only does house calls. Oh,
wow.
Oh, wow. So I've been better ever since I saw him because it just makes me happy that my doctor is sitting right there, knows where I live. We have meals in my kitchen. He actually helped me take my purses that I was using my bicycle for in my bedroom. He helped me take my purses off the bicycle. But he intimately knows the environment that I live in. He knows how I feel emotionally. He's like an extended part of the family. And I would say that's the way what our students are now wanting us in the United States to create a system where they're not integrating into a medical practice, but integrating into families and neighborhoods and communities.
Well, they must be very much respected in their neighborhoods, in their communities, the doctors. Not to underestimate the schools, the academies, the studies that, for example, UNM has, and other universities that bring the medical degree, the medical career to our people. It must be a challenge for our students because it must be a part of their training, of their academics, to learn how financially the healthcare system here in the United States works. The insurances, to be aware of because we have a lot of uninsured people, especially here in Albuquerque. Right. Even though our administration is making efforts to give, like Medicaid, there's still a lot of people that don't qualify for the Medicaid. So it's very interesting how two countries, Cuba and the United States, can work together, in this sense, and complement each other.
That is true.
What do you think?
That is true. And the United States is the only developed country that doesn't have an organized healthcare system where there's at least one level where everyone is covered just because they're a citizen. We are also the only country for developed or whatever, which has not signed the Declaration of Human Rights, that healthcare is a right. And so the World Health Organization a few years ago actually held a worldwide conference in Cuba to look at the difference between having health as a commodity that you can have as much as you can pay for, and having health as a right. And they really concentrated on the fact that the countries that provide as much health care as they have money don't do as good a job as Cuba, because Cuba uses human resources, which you don't have to spend so much money, if I'm saying that correctly. And so they begin by education so that people understand about their health and how to take care of themselves as a part of just your normal education. So, for example, there is a garden in almost every school so that you learn nutrition in that way. We have some programs like that here in New Mexico, but they are not part of like the school system. There are nonprofits, organizations that have started where people want to combine having farm food accessible at least once a day to students in the classroom, but that is like a community effort. It's not one of our mandated things. So what I'm saying is that with the more effective use of people, more effective use of community workers where families are educated, we're the only developed country that doesn't have like universal maternity and paternity leave, or Cuba even has grandparent leave when a baby is born. And so the idea of putting as much education into the community so that, first of all, people don't get so sick that you have that many sick people to take care of, but being able to catch things earlier and prevent things from getting so bad that now you really need to invest a lot in healthcare.
Yes. You know, last year I read, I don't remember the exact date, but it was a newspaper of La Jornada in Mexico City, and they did an extended article of Mexican administration opening the doors for 600 Cuban doctors. That's because Mexico has also a low number of doctors, and they were hired by El Seguro Social, which is the Mexican public health system. And they're working now there, and most possibly Mexican administration and Cuban administration, Cuban university has some kind of working,
That's exactly true. And Mexico is in such a good position to collaborate, especially now with the leadership that Mexico has.
Yes.
And the sovereignty that they insist on. But I work globally. I'm all over the place. And in every country that I go in Africa or in Latin America, I say Cuba, they say doctors.
Okay.
That's their idea.
That's one of the things that Cuba offers to the world.
Right, is that it actually, it's a, how can I say it? It's a strategy for peace. Because Fidel felt that with the school, the international school, if young people came together and got to know each other as they were learning about something that every country needs, they would be less likely to declare war on each other. So Cuba has 4 international schools, but we only go to the School of Medicine. But then the other thing is that is Cuba's primary export is doctors. And doctors don't, and it's funny because the average doctor in Cuba is a woman.
Oh.
But when we first started going there 25 years ago, the garbage people made more money per month than the doctors. because everyone wants to be a doctor because you're giving something back to your community, and you don't get more money. You live in your neighborhood. You don't get a car. The doctors are walking and on the buses and public transportation like everyone else. Someone has to stand in line for the rations for food while the doctors are working. And if you could imagine, if you live in the neighborhood, everybody wants to tell you when they see you where they have an owie or pain. So it's not like a class thing. It's something that you do because you feel like ultimately I'm giving life. I'm helping my people have life.
Yes. And I'm assuming, I'm speculating that that's the same opportunity for other medical technicians, you know, like radiology, like
all of it. And that's why the people who were the garbage collectors as well, it's like whatever you do is a part of public health, because we're just discovering social determinants of health in the U.S. We're just beginning to talk about it, but health is determined by whether or not you have housing, whether or not you have appropriate food. Cuba is one of 3 countries that's implementing the Beijing Women's Platform. If you hit your wife in Cuba, you are going to jail. You know, so
that's a hard thing because
Cuba is one of the safest countries in the world. They're part of the 10 countries that are safest for women. You know, so it's like looking at the whole thing, not just like, can you get some medicine if you're sick?
Yes. I think this is a hard question. You know, we have a Cuban community here in Albuquerque, Cuban immigrant community. They've reached the U.S. With a lot of effort, you know, to look for more opportunities. And they are very worried. Our Cuban, you know, community, I don't want to sound like it's ours, you know, but the Cuban people here in Albuquerque are very worried of the blockage. And they hear that their relatives in Cuba are very limited right now with the hospitals. The clinics are very limited with medications and resources, you know, hospital, medical, very simple words, from medication to gauzes, to injections, to instruments. What can you say about that? The Cuban people here are just very worried and very frustrated of what is happening with the blockage.
I think they are justifiably worried. The whole world, and when I say the whole world, for me, it's like the UN, in which I'm connected with the UN, that represents all of the countries in the world. For the last almost 30 years, once a year, they have voted on that very same topic. And every country in the UN, except for 2 or 3 countries, meaning the United States, Israel, and one other country that's our partner at any given time, the whole UN, besides those 3, have voted that the blockade is inhumane and should be stopped. There are different people come to the United States from Cuba for different reasons, just like people come from every country in the world for different reasons. But in the last few years, the majority of people who come to the United States from Cuba are coming for economic reasons. You know, when you cannot do banking, when you cannot. And so this year, for the first time, the UN changed the question that they voted on, because they realized after all these years, the blockade is not on Cuba, it's on the whole world. Because it says to the whole world, if you do business with Cuba, we are going to sue you. They're not suing Cuba, they're suing the other countries. So when you think about it, they're the ones that are being told you cannot do business with who you want to do business with.
That's true.
That's true.
That's what I've read all over in the newspapers in Latin America. Yes,
it's very hard for a person from the United States who's never been in Cuba, not as a tourist, but who has a family or know people where you're really like living with people. And one of the best things that we did when Obama was president, when we were looking at normalizing that relationship, was one of the rules is that you couldn't live in the fancy hotels. You had to live in what we call here casa particulars. Mm-hmm. And what that did is, like, even with my students, they had to move out of the dorm because we didn't have oil enough to cook food. So we had to find housing in neighborhoods. You really get to live in a neighborhood. And so now you understand what it's like. When I was there last month, for 3 days we had no electricity, mm-hmm. and we had no oil. And so that means you can't get gas for your car. You can't cook anything. You put stuff in your refrigerator goes bad. The electricity can't pump the water through the water system for your house. So you can't get any water into your house. You can't drink, water to drink. You can't take a bath. You can't clean your house. You can't start cooking because you don't know when the fire is going to go out. And for medicine, we do not have medicine. When you think about the blockade has not alienated, but put Cuba from being in contact with a lot of things that they would have gotten that everybody else could buy. They can't buy it, so they've been forced to have to make a lot of things on their own. So they have some of the best immunizations in the world. Their COVID vaccine is very different and very more effective than others. What they're doing with diabetes, like half the people in the United States who had amputations last year for with diabetes, if they had this other medication that's available in Cuba, we wouldn't have had that. Mm-hmm. And so they've had to go to that extreme and do things because they couldn't do what other people were doing. Mm-hmm. And so this blockade is hurting so much, and they've always been able, to like figure out how to make it work. But now we're at the point where people are strangled. You can imagine it's as hot there as it is in Florida at this moment, but there's no air conditioning. Mm-hmm. And the impact that heat has on people.
Well, I think the point here is that the people don't deserve this, but it's all of this is politics, and they want to, our administration's policies just to see how much Cuba can take. And to ¿cómo se dice ahorcar? How do you say that? The people. So so Kathryn, you were mentioning to me that you're here in New Mexico also to offer these opportunities to for medical students or for people that want to participate in this program. What's this program called officially?
Well, actually, there are a couple of things. We're still accepting students for the medical school. And so I want to make sure that people know and can share that information and contact me if want more information about the requirements for the medical school. That's one thing. The other thing is that I personally am in a position to have interns and fellows. We actually bring fellows to New Mexico every summer now to actually shadow doctors and to get a better understanding of the public health system here. That's one thing. And the other thing, with my affiliation with the UN, I'm looking for students that are interested in global medicine, interested in widening their worlds to include not only their neighborhood and their state, but see how that fits in with the global community. Mm-hmm. And we have very little representation at the global international level of students of color. So I'm just on a mission, to let young people know this is a door that you could look through as well, and to find where we have things in common with other countries and who are our allies in other countries. As a public health person, until I was working in Cuba, I thought the American Public Health Association was like, that was the thing that you strive for.
Mm-hmm.
But now, because of Cuba, I'm a part of PAHO, which is the Pan-American Health Association, and the U.S. is just one little component of that. Mm-hmm. And there are all these other countries that are doing things that we could benefit from being a part of it.
Okay, so if some of the students that are listening, or some people, some families that are listening to this, if they are interested, where can they contact you? How can they contact you?
Well, actually, I'm a very public person, and so we know that my email, khalltrujillo@gmail.com, will get you close to me.
You know, particularly all over the country, but particularly in New Mexico, now that we're in crisis of doctors, we need doctors all over.
We do. And I'm so pleased that Mexico is actually standing up, and we have the kind of legislators who are understanding, appreciating, and supporting that, and supporting normalizing the relationship with Cuba.
Okay. Thank you so much. Anything else?
I would just like to say, I think today is so appropriate, because as we are thinking about what would make a people say, we don't want to be colonized, we want to be sovereign. And I think that anyone that's celebrating that today could understand how the people of Cuba are saying that same exact thing. We do not want to be colonized. We do not want anyone to come in and tell us what to do. We think we know what we want. Mm-hmm. And that is a universal need that people have. And so I'm hoping that people here who are celebrating the 4th of July could understand that that is the exact same spirit that guides the people of Cuba to say, we don't want a king. We think we can do this ourselves.
Yes, that's true.
Thank you.
Thank you so much, Kathryn.